evening. Thanks for always staying with Lagos Television. I am Olasunbo Mudupe. The program is Sound Health. Today on the program, we are taking a look at monkeypox. According to the Nigerian Center for Disease Control, over 170 new cases have been reported in the country. About 60 cases were reported from 10 states. Today, we'll take a look at how to curb the further spread of this disease in Nigeria. Stay tuned. The conversation begins after this break.
More than 18,000 cases of monkeypox have now been reported to WHO from 78 countries, with more than 70% of cases reported from the European region and 25% from the region of the Americas. So far, 5 deaths have been reported, and about 10% of cases are admitted to hospital to manage the pain caused by the disease. This is an outbreak that can be stopped if countries, communities, and individuals inform themselves, take the risk seriously, and take the steps needed to stop transmission and protect vulnerable groups.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Japhet Olugbogi, Chairman, Nigerian Medical Association, Lagos Committee on Infectious Diseases, and Medical Officer of Health for Ifelodun Local Council Development Area. Good evening, and thanks for always joining us, Dr. Olugbogi.
Thank you for always having me. It's my pleasure to be here.
All right, Dr. Olugbogi, just recently, about 60 new cases were reported from 10 states. What causes monkeypox? Why are we experiencing a sudden increase?
Monkeypox is a viral disease that is common in West Africa. Research studies show that it originated from DR Congo when somebody had the first case in 1970. Well, we can say that it's a disease that can be gotten from close to interactions with rodents, with rats, with monkeys, with what we tag bushmeat. And you would agree with me that in West Africa, we do have a lot of interactions with wild animals and bushmeat, if you may call it that way. So it's actually a problem of West Africa, but now it's spread all over the whole world with pockets of cases in Europe, America, and even Asia. So it's not just a problem or a public health problem limited to West Africa alone. It is now a public health emergency as declared by the WHO. This is not only connected to the fact that human beings interact, and it's a global world now. People move from one place to the other, and monkeypox is a virus that spreads very easily from contact with people who have monkeypox. So that is why we now have pockets of cases reported all over the place.
All right, could this be attributed to low awareness among people in the country?
Low awareness is definitely one of the reasons why we have this issue. But another reason is our continued deforestation, our continued interaction with wild animals, and you can't call it climate change, and anything that has to do with clearing bushes, clearing forests. These activities release animals into the communities. Because naturally, when their habitat is disturbed, they move into the homes, and then people naturally maybe consume these animals or interact with these animals and all that. And so we have different cases of viral infections coming up all over the place.
All right, out of the 60 suspected cases reported from 12 states, 15 new confirmed cases have been reported by the Nigerian Center for Disease Control. Children are not left out of this. How do we manage this crisis? And what are let's look at the symptoms to start with before we talk about how to manage this disease.
Well, the symptoms are basically fever, chills, the cough, the headaches, body pain, general feeling of unwell, and they also have what we call lymphadenopathy. Lymphadenopathy is the swelling in some parts of the body. But the major symptom that strike people is the rash. The rash is it looks similar to the rash of chickenpox, but monkeypox itself is not similar to chickenpox, and the rashes are also quite different from that of chickenpox because they can be more painful, yet they can be itchy. Chickenpox rashes are also itchy, but they can be more painful and they can be much bigger than the rash of chickenpox. And also, the distribution of this monkeypox rash is such that you find a lot of them in the genital area, around the genitalia, whether male or female genitalia, around the anus, around the. So you have this distribution pattern favoring distribution in the genitalia, although we have them on the face, on the cheeks, around the mouth, on the hands, and on the feet as well. But they have a predilection for spreading around the genitalia. And this is one of the reasons why it's been reported that it's also found more in people that have sex, men that have sex with men, if you know what I'm saying. So they tend to spread the virus through that avenue during sexual intercourse.
All right, children are now seen coming up with this disease. Is the symptoms, or are the symptoms the same in children and adults?
Oh yes, the symptoms are largely the same in the children and adults, but we know children may be a little bit more sicker than adults when they have the symptoms because they can't tell you really what exactly is wrong with them. It's only when you pick up or what you pick up from them that you can tell is wrong with them. So yes, they are basically the same symptoms in adults and in children.
All right. Is this disease treatable? Are there vaccines to prevent the spread of this disease in the public?
The answer is no, and the answer is also yes. No, in the sense that the monkeypox virus itself does not have a cure. So we don't have a cure right now in circulation all over the world to cure monkeypox virus. But the symptoms can be cured. What I mean by that is that there's what we call supportive treatment in medicine, in medical and nursing care. So when the individual comes up with fever and chills, we give something to allay the fever, we give something to allay the chills. When the individual comes up with headache or body pain, we give something to allay that. When the individual comes up with the rashes, whether the rashes are at the scalp stage or the stages where they're bringing water or they are even drying up, we give something to allay that. So we have supportive treatment for it. And when you give the individual a good supportive treatment, they tend to heal up because it has been reported that there are just fewer deaths reported from monkeypox. It is not as fatal as some other viruses that have come before it or that are around at the same time with it. So the symptoms are treatable, but there's no treatment for the virus itself. Also, we do not have a vaccine for it right now, but we know that the smallpox vaccine also works for it because smallpox and monkeypox are from the same family of variola viruses. So the smallpox vaccine works effectively, at least about 85 to 90% effective against monkeypox. But as we speak, biomedical researchers are working on the production of the smallpox vaccines, and they are yet to be mass produced for the general populace.
All right, since there are no vaccines in place, what are the surveillance and disease response put in place by the state government or public health officials?
There's been a lot of noise, there's been a lot of creation of awareness What we are doing right now is also part of the awareness creation. The disease notification surveillance officers in all the local governments and LCDAs are out and working. They are sensitizing people. The health education officers have held what we call community sensitization meetings with the social mobilization committee members. And also, there's been a lot of information on the internet as well, on the social media handles of the different officers that are tasked with, creating awareness on this. And different bodies, different organizations, the Nigerian Medical Association, and all whatnots, have been making information possible and available to the general populace on this. But then again, we need to avoid close contact with animals, with wild animals. We need to avoid preparing animals for consumption, for preparing wild and bush animals for consumption at this point in time, because consumption of wild animals predisposes to contraction of the virus. Even scratches from rodents that have been exposed harboring this virus can also transmit the infection to humans. So we also need to avoid indiscriminate sex with partners that we don't have or that we don't know, to avoid picking up this virus from them, because close contacts can make somebody have this virus. Respiratory droplets, that is things that are coming out from their mouth, from their nostrils, the aerosols, one can contact the virus from them. Even ordinary being in contact with beddings, towels, clothing that somebody who has monkeypox has used or is using can also transmit the infection. Also, healthcare workers need to be extra careful because the box stops at their table because they are exposed to a lot of patients. And before they even have the opportunity of finding out what exactly the individual has, they may have picked up the virus from that person. So they need to wear their PPEs, wear their face masks, wear gloves, and be on the lookout when they attend to their clients.
All right, Dr. Olugbogi, you mentioned that people who derive pleasure in eating bushmeat, game meat, and all that, especially those who are also into deforestation. What advice do you have for these particular sets of people? Are there plans in place for people at the grassroots?
Well, I remember the Honorable Commissioner for Health did a video some time ago, and it was a paid advert on TV just to sensitize people on to stop consumption of bushmeat, to stop the patronage of those who deal in bushmeat. Now, the point is that nobody is saying that we should not eat. We have means of livelihood for the individual, but we need to be careful because it is not only the consumption of the bushmeat that can transmit the infection. While the individual is trying to catch the bushmeat in the first place, there may be scratches, there may be, physical contact with the animal, and that can also transmit the infection. So we're not even just talking about eating or not eating bushmeat alone, but being careful from bushmeat, from rodents, from rats, from possums. These have been documented to transmit monkeypox virus to humans.
Are the public health measures such as hand washing still effective against this kind of disease, like we had during the COVID-19?
Absolutely, yes. Public health measures like hand washing, like wearing your face mask, like personal hygiene, are very relevant for this virus and for so many other infectious diseases that we can think of. Because inadvertently, we take our hands to our mouth. A lot of people use their hands or fingers to rub their noses. And you touch rails, you touch beddings, you touch keys, you touch door handles, you touch toilet handles. So we need to wash our hands regularly, and we also need to sanitize our hands regularly to avoid picking up flu, influenza, viruses, germs, bacteria, everything you can think of.
Dr. Japhet Olugbogi, Chairman, Nigerian Medical Association, Lagos Committee on Infectious Diseases, and Medical Officer of Health for Ifelodun Local Council Development Area. Thank you so much for your expertise on monkeypox. We really appreciate you.
Thank you very much for always having me. It's my pleasure.
All right. Basic public health measures are key to ending monkeypox or other related deadly diseases. Wash your hands, wear your mask, and avoid large crowds. It is still Sound Health on Lagos Television. We now bring you up to speed with trending health report from around the world. Please stay tuned. This is where we say thank you on today's episode of Sound Health. Whatever you do, get the vaccines, protect yourself and your loved ones. Join me again next week for another edition. But before then, for comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.